and welcome to Women's Health Tech Wednesdays. I am your host, Nina Joshi. I have one quick announcement before we bring on our guest for today. We have our June symposium coming up this week. Make sure that you get your tickets using the link in the chat. And with that, we'd like to formally introduce our guest for today, Melissa Bowley, who is the CEO and founder of Flourish Care. As you know, we love questions here at Women's Health Tech Wednesdays. So if you have any for Melissa, use the Q&A feature or the chat, and I will make sure that we get to it. With that, so excited to have you on today, Melissa.
Thank you, Nina. I'm so excited to be here. And I've joined these in the past, so I'm excited to actually be, participating this time as one
Well,
of
on the other side.
the. Yeah, exactly.
It's amazing. Well, Melissa, I think as you know, a great place that we like to start is with just kind of sharing with our audience today a little bit more about your background and kind of, the journey that has led you to where you are right now as a CEO and founder.
Thanks so much. So yes, I am the CEO and founder of Flourish Care. Just a high level, we are a tech-enabled doula platform. So we're providing wraparound care for mothers from pregnancy through birth and postpartum. And we really work integrated with OB clinics and we're fully reimbursed by insurance. So it's been a really exciting journey, but this is not how I started, which is the path of many founders, right? Um, so I started out actually, I'm a biomedical engineer by training. And I spent most of my career developing medical devices in tissue engineering and regenerative medicine and things like a lot of women's health focus, actually. So, breast reconstruction after cancer, pelvic floor prolapse, hernia repair, things of that nature, and moved quickly from R&D into marketing and sales ultimately, just as I kind of followed that full product life cycle. And it was while I was leading a sales team of about 250 sales reps at Becton Dickinson in the soft tissue repair markets that I became pregnant myself. And
Mm.
that was about 10 years ago. I can't believe it's been 10 years. And I was going through the health system that I knew so well. I'd spent so much time there in my career in healthcare for 15 plus years at the time. And I was like, oh, pregnancy is going to be a breeze. And it was really challenging. I didn't feel like I was being heard. I didn't feel like I was getting enough time with my OB. And I was talking to a fellow engineering friend of mine about it. And she was like, I think you would benefit from a doula. And I looked at her, I was like, a do what? What are you talking about? And I went back to PubMed, which is where I love to do all my clinical research, and put in what is a doula? And 500 peer-reviewed articles showed up showing lower C-section rates, lower NICU stays, better breastfeeding outcomes, better postpartum depression, anxiety outcomes. So I just didn't understand why this wasn't standard of care. I ended up getting a doula. I was 8 months pregnant when I figured out what a doula was and actually got a
Wow.
doula. And I had her for both of the births, and it was a lifesaver. And I just didn't understand why that level of care with that much evidence wasn't the
Mhm.
standard. So I left my med device career and started what is now today Flourish Care in order to improve access to doula care for all families. And when we started, only two states were reimbursing. That was in 2020. Two states were reimbursing for doula care. Now, because of all the evidence behind it, it's being mandated by law in 46 states across the country, especially for Medicaid. And then you see more and more states actually opting in and passing legislation for commercial coverage as well.
That's amazing. I mean, there's so much I want to dive into when it comes to your own personal experience and just, what it is to be a founder of a company with a great mission. But I'm also so curious, because you've been in the general, life sciences and healthcare space just in a very different way. Was there any kind of like learnings or things that you felt like you were able to kind of carry into this new role, or was it just a whole other beast entirely?
Yes, there's a lot of like new. I love being a founder and an entrepreneur because like there's always something new around the corner.
Hmm.
Definitely lots of learnings, but I think as an engineer and my belief, even moving from R&D at the lab to product development to marketing to upstream marketing to sales. In my mind, it's all problem solving and like really peeling back that onion and understanding unmet needs. And I feel like that is like what you're in engineering at least and throughout my career at all the top 10 medical device companies, it was all around what is the true need? What is the need of the clinician or the need of the patient at the end of the day? And once you're able to really define that need, there's a lot of different ways you can go about the solution. And I think that was really what helped me throughout my journey, not only kind of develop the first platform, but also pivot is like that constant, like what do our who are our clients? Is it the insurance company? Is it the
Right.
patient? Is it the, insurance company? Is it the provider, the OB clinic? And the answer is yes to all those. And there's a different
Mhm.
solution, for each one of those that needs to be incorporated into your solution in order to be successful in healthcare. But that was, I think, the one thing that really carried through was just that real the way that you ask the questions, the way that you really understand what the unmet needs are, and your willingness to pivot and be like, okay, market dynamics have shifted. And we started out as private pay, and then the legislation was changing. We were part of that legislation change, but then we
Mhm.
pivoted into reimbursed services. So like it really is that listening to your customer, understanding who your customer is, listening to your customer, and then being like open to pivoting as you grow.
That's yeah, I could totally imagine kind of, having been in kind of a corporate environment, to now like being in a whole new space. To your point, I'm sure there must have been a lot of like those transferable skills, but also new things you've had to like pick up along the way when you are kind of your own boss, so to speak.
Right. Yeah, the corporate it's funny because I feel like in corporate world you're almost sometimes you just don't take as many risks, right? Like you've
Mm,
got narrow scope and
right.
a lot of like a BD is a large company. There's a lot of liability. You're not going to take those risks. So it's really kind of fun to step out of that and be like, okay, how do we, build a solution and really iterate quickly? Like, oh, wait, this is working. Oh, no, this isn't. And you can actually put out a
Mhm.
solution, get feedback, and make changes on the fly, which is really pretty incredible. Hard to do in large medical device companies.
Totally. Very understandable. Um, I'm also so curious because you had this incredible personal experience with a doula. What was there something in specific that kind of made that connection for you that made you take that leap of, you know what, this is something that I should really be building and kind of creating for everyone? Was it just something that you were percolating for a while? Was it a specific stat? Or yeah, would love if you can walk us through what was it that just made you be like, I have to be the one to do this.
Yeah. So I think it was the personal experience with doula care, but at that point I didn't know. This is now going back like my first son was born 10 years ago. My second son is 8 years old. So 8 years ago was when I started kind of percolating with the idea afterwards. And I didn't know we were in the middle of a maternal health care crisis. Like I knew I was personally feeling the gaps in maternal
Mhm.
health care, which the doula filled many of those gaps and really I think in my mind gave me a great experience and saved my life in some cases. But it wasn't, I didn't know how bad it had gotten. I didn't realize, I imagined I wasn't alone. So we did a lot of market research just in our local community to start. And then I started just doing a lot of like research again, kind of going back to, PubMed and going into like what's going on in other countries, how have they solved these problems, and went down the rabbit hole and saw that like a lot of these solutions were already being implemented in other countries and turning the mortality and morbidity rates around. And then I also saw the stats, like the most recent one. Back then, I feel like the statistics weren't as clear, but like the CDC put out the latest mortality stats, and we are the worst of any industrialized nation in the US for maternal mortality and morbidity. And a woman is actually 3.5 times more likely to die or suffer a life-threatening complication during childbirth and postpartum than her own mother was a generation ago. So it was like those statistics where I was like, this is not okay. And like the most advanced medical advanced country, we should be able to support our mothers. And it just didn't feel, even me personally going through it, that maternal health was the priority. It was all about baby. And I joke
Mhm.
around that I felt like the candy wrapper. It was like once the baby was here, it's just like mom gets tossed aside. Like, great, you did good. You have a healthy baby, and that's all that matters. And there's just so much more to it that like if moms are not okay, society's not going to be okay.
Right. I love that. Yeah, and I'm sure that like just really seeing the scope of the problem, I'm sure was just like an eye opener. And I would love this may be a silly question, but would actually love like a refresher because when I hear the word doula, in my mind, I think of something very specific of like, okay, this is probably what a doula does. But I feel like there's probably so much more that a doula does that I don't even know about. So I'd love if you could tell us a little bit more of like, what is a doula? What are all of the services that a doula does from like, before delivery to I don't know, but maybe post delivery. Would love your insight on that.
Yeah, and I think it's a great question because even though doula care has grown so much, I often forget that people still don't know. I didn't know what a doula was, and I had to look into it. So like we're still at
Hmm.
that stage where there's so much opportunity
Yes.
for doula care, but a lot of people still don't know the value and also don't know how to incorporate it into our current clinical workflows, which is what Flourish Care does. Like we're working alongside the OB teams. We're there with the OB, the midwife, the social worker, and we're an extension of that team that exists in the community. So that's the way I would kind of describe doula care is like that community health worker or peer support that exists outside the walls of the clinic. We know that 80% of our health is established in the community. It's not within healthcare. It's not within the health
Hmm.
system. Healthcare is in the communities. So it's really that community-based support that's really focused on pregnancy, birth, and postpartum. So our doulas and all doulas, they really focus in on like in between those OB visits, what are the key challenges? What do you want out of your birth? What social determinants of health might you be dealing with? That was kind of a big aha moment when we expanded back when we started our Brown University studies with the Medicaid population in 2022. We saw a huge barrier was social needs, and we weren't expecting that.
Wow.
It was just like, I can't get to my postpartum appointment because I don't have transportation. I'm worried
Hmm.
about how I'm going to put food on the table. So if the basic needs aren't being met, mom is not taking care of herself. She's not able to take care of her baby. So that was a big aha. So that's a lot of what doulas do is having those conversations, and it's all through human connection and building this relationship outside of the health system around what are your needs? How do you want this birth to go? Do you want a C-section? Do you want an epidural? What are the things that you want? And if you have questions about what your options are, let's talk through all those options. So they're usually filling out during that first visit a birth preferences sheet where they go through kind of everything that they need and want, and it actually triggers a lot of questions like, oh, I need postpartum. I mean, I'm going to be bleeding for 6 week postpartum. I probably need somebody to help me out in my home during that time. And those are things that we're not talking about in those 15-minute visits with the OB. So then we support them all the way through. So we talk about preparing for breastfeeding, preparing for postpartum recovery, talking about their social needs, who's in their support system, what help do they have for afterwards, what does their maternity leave look like. And so we talk through all of that. We prepare, there's usually another visit. So usually through insurance, you get 3 prenatal visits,
Hmm.
which starts at about 12 weeks during pregnancy and goes all the way up to the birth. And that's like scheduled during certain times, or they can move it around. Right before birth, it's like we're going through the birth plan one more time. Has anything changed? This is what we want. This is what you've talked to your OB or your midwife about, and making sure everyone's on the same page. We are there in person for
Mm.
the actual birth to make sure that everything that we've talked about to date is, going as well to plan as it can, or at least you feel like you're part of the decision making. Like if for some reason you need to convert to a C-section, are you having these, conversations with your provider about what the pros and cons may be, what the risks are, so that you feel like you are part of the decision making process. We're not making decisions, we're not doing anything clinical whatsoever. We're empowering the patient to ask the right questions and
Mm.
empowering them to ultimately get the outcomes and experience that they're looking for. And then on the back end, we check in. So our typical visit postpartum is about 11 days after baby's been born. We're checking
Mm.
in. How are you doing, mom? Are you recovering? How's breastfeeding going if that's what you've chosen? How's bottle feeding going if that's what you've chosen? Do you know how to do you know how to put diapers on? Do you know how to bathe the baby? We go through all this stuff to make sure that they're set up for success. And they usually have about 3 to, some states have actually put like 15 max hours of support that they get through insurance, which is really incredible. And again, all of this has been shown in the evidence to improve outcomes. So it's really providing that wraparound care, wrapping that mom around with all the care she needs from through that very vulnerable time.
That is absolutely incredible. And I'm so curious too, as number one, that was a great refresher for me. So thank you for that.
Of course.
And then two, would love to kind of dive in a little bit more into Flourish Care. I know you were kind of speaking to a lot of the services that you're kind of providing, but would love if you can dive in more into kind of, is there a platform? Is this something that, maybe for any expecting moms, they can kind of raise their hand and say, I want to be a part of Flourish Care, or do they need to get referred by an OB? Would love if you can walk
Yeah.
us through what that platform looks like.
That's a great question. So we see about 40 to 50% of families that come to Flourish Care. And right now we have 15 insurance contracts. So we're in network as a provider across New Jersey, Rhode Island, and Massachusetts. And then we have doulas across 10 states. We're working on getting additional insurance contracts, but then we also have TRICARE for military families. So we do really focus in on the Northeast, and we're expanding across the country now, which is really exciting. So come to us if you're you're in those states. We'll get you set up. But ultimately, about 40 to 50% of our patients come to us via a referral. So they are coming from like their OB. We partner with them. We actually bring doulas in to do trainings, and we talk about what does this, collaborative team approach look like. And then they have a provider starter kit, and they're able to make referrals very seamlessly through the EHR. So we're integrated into the EHR, or which is the electronic health record for some people. I remember when I started this, I was like, what is that? So yeah. There's lots of acronyms. So we're
Hmm.
integrated into EHRs, and we also have a HIPAA compliant referral page just on our website that people come to. So we're seeing people, the OBs or midwives are saying, "Hey, this is the new standard of care. You get me in the clinic to support you, and you get somebody based in the community, and we're all working together to make sure you get the best possible outcomes. And here's how to check your insurance." So we check their insurance, we let them know what they're eligible for, and then we match them based on cultural preferences, language preferences, and where they're located. And then the first meeting, it's digital first. So they always have a telehealth meeting to make sure that it's the right fit for them, to a doula within our network. And then we also have interpreter services so we can support all languages. And then ultimately they're off and running, and they're scheduling their additional appointments. And those can be telehealth or in person, depending on what that family needs. And then the birth support is actually in person at the hospital. So, and all of that is coordinated through our HIPAA compliant platform. So they come to us, we check their insurance, they match to a doula, and then they are within our platform getting education on maternal health. It's really focused on like, how do we take care of mom? And here's
Hmm.
all the resources available to you. And so they're getting that weekly. And then they're also able to connect via text 24/7 to their doula through the app.
Very nice. That's incredible. And I love that, kind of to your point of, you're focusing on the candy wrapper. So I love that that's kind of where your focus is.
I like it. That should be our tagline.
That should,
Focusing on the
I
candy
love that.
wrapper.
That's very important too. We need the candy wrapper. I love that. And I think it's so it comes across how intentional everything is that you've been building and you've been designing. And I'm also kind of so curious because I mean, like we all know with startups, it's you have a vision for it, but sometimes it's not always a straight line. There's all of these deviations. Would love to learn, like, is that something that you also kind of experienced as you have been kind of growing the company? Yeah, would love to learn like what you've learned kind of along the way from maybe Flourish Care 1.0 to now Flourish Care 2.0.
Yeah, it's a really great question. And I think back to kind of the first version. So we launched in 2020. Well, we formed the company in 2020, which March
Mhm.
2020 was a very interesting time.
Wow.
Build, yes, it was March 12th that we incorporated, and like we had our first recruitment event on March 27th in the Boston area and had to shut that down. And we really focused on education and awareness while we built out our amazing provider network. Our first version of the company was actually because there was no reimbursement at the time, was a
Mm.
baby registry where people could put in, your friends and family could put in dollars for doula care. So it was a
Wow.
very different, but it was like still trying to, we knew the need. We knew
Yes.
people, this was essentially like a basic need that insurance at that point was not covering yet. So where else do they get funding from? They get it from their baby registry. And that was kind of the first version. And while we were doing that, the insurance companies, the mandates started happening. We were part of those, like in 2019, I was at the State House fighting for insurance reimbursement for doula care after having my own experience. The mandates started coming through, and the insurance companies started knocking on our door saying, hey, we need to operationalize doula care because it's state mandated now. Can you
Mhm.
help us? You have a provider network, you have a platform. Can you help us with operationalizing this? And we partnered early on in 2021, I think we signed the contract in 2022 was when we did that Brown University study where we did a pilot within a Medicaid population, working to make sure that we were hip to hip integrated with their care team at a high risk clinic. And that's really how the product got built, was in collaboration with that ACO. And then ultimately we were able to launch that more broadly in 2023 with insurance reimbursement in our first contracts. So I think if you're not pivoting, I hate to say this, but I think you're doing something wrong. Like I think
Mhm.
every like successful company has some pivots because market dynamics change, the needs of the customer change at the end of the day, and you need to be able to be flexible and kind of follow the need and make sure
For
you're
sure.
solving for a real need.
100%. I love that. And I personally have so many questions to ask you, but I do want to make sure that we save some time for our audience questions because
Well,
we have
it's
some really good ones.
12:52. The
I
time is
know
going
time is
by.
flying. So let's see how much we can get through, but we have some great questions. So the first question that we have is, have you considered expanding Flourish's services to include fertility or miscarriage doulas? We'd love to hear your thoughts on whether that's something you have explored or might envision in the future.
It's a really great question. We do cover miscarriage today. So loss, all of our doulas. I didn't mention when doulas join Flourish, we handle all the admin for them. We get them up and running on contract, but we also do continued education. And one of the key components to the four areas that we focused on is loss, perinatal mental health, trauma-informed care, and substance use disorder. So those are all standard education that we do for Flourish Care doulas when they come into our network. And that's because that is something that is a huge need. And we found that again through the clinical study that we ran, that there was additional skill sets that once you go from supporting private pay patients, which was the only way doulas were doing it 2 years
Right.
ago, 3 years ago, to supporting insurance covered patients, like there's just different needs. So we've established that training. So yes, miscarriage is covered in all states with reimbursed doula care. Fertility is not to date. So that's something that we think there's a ton of value. And actually, a lot of the people that are within our organization started with their doula during their fertility
Mm.
days and then moved into having that doula through the birth and everything. So I think it's a great continuum, but that's not something that we're looking at right now due to the insurance reimbursement
Right.
landscape.
Gotcha. Very helpful. Awesome. Our next question is, I've seen a handful of different doula services slash startups. How did you differentiate your startup? I sometimes have doubts of this already exists when thinking of maternal health startup ideas for myself.
Yeah, I think one thing that maternal health is such a big problem. There's 4 million pregnancies in this country. And for example, doula care today, even with the reimbursement, only 6% of patient families are getting access to doula care. 6% of 4 million. And so that's growing. So there's lots of opportunity. And I think it's going to take multiple solutions to actually, solve for the maternal health crisis. So I don't believe in the like it's going to be one company and it's only one solution. There's so many challenges and so many needs that there's got to be multiple companies, and it's been underserved for so long. So there's just tons and tons of opportunity out there. So I would say that shouldn't hold you back. In the doula space specifically, we really see it as an integration to the existing clinical workflow. So that's been our differentiator, is like we are working alongside, we are part of that birth team. So we
Mhm.
know the OBs at our partner clinics. We're working with the midwives. They're getting feedback on how their patients are doing as we're, taking charting notes and all that stuff and working with their families. So that's been our clear differentiator, is insurance reimbursement, and being able to work directly with the OB clinics, the FQHCs, the federally qualified health clinics out there. We partner with them directly.
Very cool. Awesome. Our next question is, I'd love to start something in maternal health. How did Melissa get started after doing the research? Were there any initial steps to launch your startup in a field where you didn't necessarily have like a non-health background or like a clinician background?
Yeah, I think having a chief clinical officer is key. So you want to get yourself surrounded by the right advisors. I did a lot of accelerators. So I was part of Springboard. I was part of Ignite is another wonderful one. The first ever one I did was a local one in Rhode Island, Social Enterprise Greenhouse, which was all about social impact. So I feel like those are great ways to kind of kickstart and really, again, peel back the onion on what the unmet need is that you're solving for and what the stakeholders are around that unmet need and like what value are you bringing to each one of these stakeholders. So I think that was extremely valuable. And then my network kind of grew from there. So I had people from insurance companies that were advising me on how to get my first insurance contracts. We have a chief clinical officer who's the head of midwifery and is a professor at Brown. So from a clinical perspective, somebody who's seeing patients every single day. So we have that as like our guiding light in the company. So I do think really those you can do too many accelerators too. So I'm not saying like do them all, but I think that when you have an idea, it's a really great way to have a framework. And I was working at BD at the time, so I was like using my vacation time to kind of build out the business. But it gave me that diligence and framework to continue to work on it throughout. And I worked on in medical devices, part-time consulting and stuff like that for a lot of building the company as well.
Wow, that's amazing. And number one, that is amazing, that in of itself. But I love that idea of that kind of advice too about accelerators, kind of finding the right people, expanding the network, all of that fun stuff. Um, we have about 2 minutes. I'll answer one last audience question. We have some amazing questions. And for folks, I'm so sorry if if I'm not able to answer your question, Melissa's LinkedIn is in the chat. So feel free to ask her directly.
Please reach out.
Um, yes. And so maybe the last question we'll do is, oh, this is just kind of the one that I see top of mind is, when did you know to transition to full time?
When we got like enough funding for it to make sense.
Nice.
So I feel like I was working as a consultant in order to fund the company. So the first employees that were getting paid were not me. It was the people like to get what we needed to on the idea up off the ground. So I think I went without pay for 3 years. And then when we got, the our first round of seed funding in, that was when we were able to make the jump into full time. So and still like the way you get paid in a startup, don't expect what you were making before in corporate world. So the sacrifices continue to come, but if you feel passionate enough about the problem that you're solving, you'll overcome those challenges, salaries being one of them.
That's incredible. And honestly, that's like such a beautiful way to like end our discussion. Melissa, this has been such an incredible conversation. The work you're doing is so inspiring. And from all of the audience questions that we're seeing, I think this is something that is also very exciting and very top of mind for them as well. So I appreciate you taking the time to chat with us today.
Thank you so much for having me. This was wonderful. And please do reach out on LinkedIn if you have any questions that I didn't get to address.
Thank you so much, Melissa. Make sure you join our next Women's Health Tech Wednesdays. Wanted to quickly thank our sponsors for sponsoring this incredible conversation, as well as give one last huge shout out to Melissa for sharing her story, her words of wisdom with us. We will see you all next week. Bye,
Thank
everyone.
you.